welcome to Fiber Connect's FCTV. My next guest here with us is Kevin Faughnder. He is CEO of Norton County Hospital in Northwest Kansas. Kevin brings a unique mix of expertise in healthcare, IT, and telecom, including more than 26 years in the Army Signal Corps, where he led communications operations around the world and retired as a colonel. He's now applying that experience to ensuring rural patients can see a specialist, access telehealth, and stay connected to care close to home. Kevin, it's really great to have you with us. Really excited to talk about some of this stuff with you. So first, let's start with telling us a little bit about Norton County Hospital and what your community looks like.
Sure. So Norton County is in Norton County, Kansas, and we're kind of on the northwest portion of the state. So if you're coming east from Colorado, we're about 4 hours from Denver. And if you take US 36, we're the first stoplight that you encounter when you leave from Denver. So it's kind of a unique little town, about 5,000 people, right around 5,300. And so our hospital services Norton County and people in the just across the border in Nebraska too. So that's kind of our focus is that area right there.
So, I've learned that when I talk to people from rural communities, the way you gauge how rural you are is like, how close is the closest Walmart?
Yeah, 70 miles.
Oh, wow.
So I was telling a friend of mine that I served in the Army with about this. And I said, I'm about 70 miles away from the nearest Walmart. And her response to me was, I can't begin to describe the amount of anxiety that just gave me. To be that rural, to be that far away from anything big, but I love it.
Yeah. But I imagine for people living in communities like that, actually being able to get to a hospital or a healthcare provider has got to be challenging, right?
It is very challenging. And so when I first took the job about 2.5 years ago, the number of people in the community, because rural health is really difficult, and there are a lot of rural hospitals that are closing because of those difficulties. And so many people in the community told me that if the hospital closes, they're leaving this community. So it's that important because so many people in rural America are older. So it's a big deal to have access to healthcare.
Yeah, and I think I read a report recently from from one of the local papers in Western Kansas, and specifically talking about like health outcomes for people who live in those rural communities are demonstrably less than they are for people who live like in urban settings where they're closer to healthcare. For example, I think it's, cancer rates, because people aren't getting preventative care or going to see if there's trouble, with their health. So I would imagine telehealth has got to be really important in those areas. Can you talk a little bit about that? And then like specifically, what are you guys doing in your hospital setting using telehealth? Yeah.
So that's really the value of why this is important, because by bringing in large broadband services, it allows people to have access to telehealth, and even our hospital. So our hospital, we've got a large pipe coming into us, one big pipe coming in. And what that allows us to do is do telehealth with other specialists. And it also allows us to use a service called a VEL. And so a VEL is in our emergency room. And so if we get overwhelmed or a very complicated ER case, our staff can hit a button and they're connected with a large facility in South Dakota with another physician, other specialists, and they're able to see inside of our ER and assist our team with helping that patient, which many times is the difference between them living and dying. So the value of having broadband services in rural America is pretty important.
Yeah. So I guess, and you need that because like you probably don't have a lot of specialists who are able to live in that community, right? So like what kinds of, give me an example of like a trauma or some kind of incident that would happen that you guys would have to use that telehealth link in that program.
So our hospital doesn't deliver babies.
Okay.
And so we don't deliver a lot of babies. However, we've got to be prepared to. So if we have a mother that comes in with a lot of complications and she could not get to her normal OBGYN. So that's where we would be thrust into delivering that baby. And so that's where we would often likely hit the telehealth button with a Vel. And so those specialists can make sure our team on the ground is able to deliver that baby for both the safety of the baby and the mother. So that's probably an easy example for where we would use something like that.
Okay. That's pretty cool. Yeah.
Yeah.
So I know you've done a lot of work with veterans. So tell me a little bit about veterans and telehealth and in rural communities. What are you kind of seeing there in terms of like being able to use internet access to get care for them?
That's a great question. And so I'm on a couple of boards with the Veterans Administration, and I received a briefing, 2 months ago or so, from a podiatrist that was really leveraging telehealth and focusing on veterans with diabetes. So about 25% of veterans develop diabetes, and a substantial portion of those develop what's called a diabetic foot ulcer. And so of those that do, about 50 to 60% of them get infected. And of those that get infected, about 20% end up losing a limb, losing a foot. So this Veterans Administration podiatrist is leveraging telehealth to connect with veterans in rural America and looking at those diabetic foot ulcers and getting in front of the problem faster, and also connecting them with infectious control specialists. So it's really making a difference for veterans, because a lot of veterans live in rural America, and of those that live in rural America, more than 50% are 65 and older. So telehealth is a huge component for their long-term independence, because if they don't have it, they're not going to get health at all because they don't want to leave their home.
Okay. All right. So most of those folks are being able to access those providers just from their home.
That's right.
Okay. And is that what you see with like a lot of older patients in your area? They don't want to have to make the drive, or are they coming to your hospital, and then you guys are still again being able to connect them to specialists, outside of your area?
That's right. It's both.
Okay.
So our hospital offers 3 different telehealth specialists: rheumatology, endocrinology, and urology. And so those people, whether they're veterans or just regular patients, would come to our hospital, and we have a system, we call her Agnes. So we get Agnes up and configured, and then we have a nurse in the room with that patient to have that telehealth appointment with that specialist. And so that's really significant from a couple of reasons. Number one, they're able to see that specialist much faster, because for a specialist, you may have to wait 3 to 6 months for a physical appointment. Whereas with the telehealth, we can often get them in substantially faster. And so our nurse stays in there and they do the charting. But what also happens is after the appointment ends, they look to that nurse and say, do I trust that person? Because they may have been that nurse's high school chemistry teacher.
Yeah.
And that connection, because they go to church together. And then the nurse says, you can. And then they often do a translation in a way that that patient understands. And so it's really substantial with what we can do. We have about 13% of our total specialty care coming from our telehealth. And so then as a veteran, you can do that from your home. You don't necessarily have to come into the hospital, but you're doing that from your home, connecting with a specialist in the actual VA enterprise. So it's both. And so having that presence, broadband presence in rural America, is what allows people to get the healthcare they need and stay at home. It's really about independence.
Yeah. So when you talk to other hospital administrators in Kansas and like throughout the country, like I understand that there's a lot of angst right now about funding, right? There have been major cuts to Medicare and Medicaid, and those are going to hit rural hospitals. I'm not sure if that's the situation that your hospital is in, but like, how is that going to impact communities? And I guess how is that going to make broadband even more important? Because more and more people that's how they're gonna be able to access care.
It's a great question. And yes, so depending on the state that you're in, Kansas was not one of the states that did the Medicaid expansion. So those Medicaid cuts are not going to be as substantial for Kansas, but they're still going to affect us. And depending on the rural population with where you're at, whether you've got a town that's got a lot of commercial business in it or not, it really has a big impact on whether or not your system is viable. So for us, we have about 50% of our population is Medicare, about 45% is commercial insurance, and we have about 5% that's actually Medicaid. So for us,
So is that kind of usual for a rural hospital, or is you guys are kind of outliers? In
we're
that
a
sense?
little different
Okay.
because a lot of rural hospitals rely primarily on Medicare, and so we're really fortunate. So that's what allows us to do a little bit more than what a lot of others would be able to do. But that emphasis on broadband also makes a huge difference for our community because it's really hard to attract specialists in rural America. Because,
I didn't think of that, but
Yeah.
you're right. Yeah.
I got there and I started trying to bring an orthopedist in. And I spoke with a senior orthopedist and he said, Kevin, I'm so busy at my hospital. Why do I want to drive 90 minutes to see patients there? So that's 3 hours of driving that I'm not seeing patients. So again, that's why that telehealth is so important, because for us, those patients may have to drive 3 to 6 hours to get that specialty appointment. So that's what telehealth does for us.
And also just the fact that, like, you're right. Like, why would somebody want to move to a community where they don't have broadband access and they feel like they're, living way back in the 20th century, without all the things that you would have other places, right? So even being able to attract talent, it sounds like that becomes, important too, right?
That's exactly where I was going. So we just hired a new physician and he's got a lot of family overseas. And that was one of the questions he asked me. What kind of internet support do you have here? Because that's all they think
That's
about
so
is
funny.
internet.
Yeah.
And I said, we've got great support in Norton, Kansas.
Yeah.
We have a company called NextTech that supports us, and it really made a difference. So all of those things add up to communities being viable, to
Right.
being thriving as much as you can in rural America. So it does make a big difference.
So to kind of get back to that question, though, about hospitals closing. So it doesn't sound like that's a situation for you guys because you're not relying on those federal programs as much. But I would imagine that there are other hospitals in your greater sort of area within the state, maybe within Nebraska, because that's close to where you guys are too. So like, is that going to put more pressure on you guys as those hospitals close? And again, that probably means people would have to drive even further to be able to get to you.
Yeah, so let me say that Norton County Hospital is on that list of at risk of closure.
Oh, okay.
When I started there 2.5 years ago, we had 7 days of cash on hand. That
Wow.
was terrible.
Yeah.
And so you need to be at 60 or better. We're now at 35. So we are making a heck of a fight getting better. So when you look at the states most at risk of hospitals closing, Kansas is number 2, only to Texas. And so when you look at the large population or the geography of Texas, we're really the number 1 state when you think about the size of Kansas compared to Texas. And so Kansas has a lot of rural hospitals at risk of closing. Now we're on the upswing, and it's a daily focus of mine and our team to get better. And that's exactly right. So when a hospital closes, it puts a huge burden on the surrounding communities because they aren't staffed for that either. And so I don't like to hear about hospitals closing. It's awful for that community. And so it's a real risk. And like I said, Kansas has the second most hospitals at risk of closing, only to Texas. So,
Wow.
yeah.
Yeah. That's incredible. So as we kind of look forward, over the next decade or so, what do you think this conversation is going to be? What are we going to be talking about in 10 years in terms of hospitals and connectivity? What are some of the applications that you see how are things going to look different, right? Like right now we're talking about just basic telehealth, being able to reach a provider, or being able to, have that connection in your emergency room. But what do you think things are going to look like in 10 years? What are we going to be talking about then?
So I think rural is different because relationships matter. Like I said, when that telehealth appointment ends, that patient looks to the nurse. They go to the same church. They see at the grocery store. They have a different level of trust. So I think you're going to see more emphasis on telehealth, but that trust relationship isn't going to change. And so I think you're still going to need a physical presence in healthcare. We're going to see advanced technology. AI is a big deal. And so AI is complicated because the governance piece of that. And so I think the smaller hospitals are struggling with that a little bit more, because I got a small team. So I can't just turn this over to someone and say, put this together, develop governance, and figure out how we're going to deploy that.
So we're not going to have robot doctors in rural America, you don't think?
Well, there are some hospitals that are actually doing some robotics, but I don't think that's in our future anytime soon. But yeah, I think you're going to continue to see more reliance on technology, and the emphasis of having adequate bandwidth to support that is only going to grow. So, but at the end of the day, most patients want to have an experience with their provider. They want to know that that provider heard them. And if that doesn't happen, they're going to find some place that they can get that.
Yeah. Well, great. It's been so great talking to you. Thank you so much for joining us. So that's it from FCTV for this segment. I really appreciate your time.
Thank you, ma'am. I enjoyed it.
Great.